Hey folks, it's Dr. Brenda, sociologist, financial coach, founder of Gutsy Women Finances Community, full-time RVer, traveling the country with my 3 cats of Gutsy Women. What do Gutsy Women do? Hey, we kayak. This is a good park for kayaking. I was out Sunday morning and hope to get out a couple more times during my stay here. Got the catio up this morning. Hey, please subscribe below. If you don't subscribe yet, come on, go ahead, hit that button. If you do, thank you so much. I appreciate it. Okay, so I am headed to a doctor today. I have been on the road for almost 2 years. It'll be 2 years in another month. And I really haven't, I've got my vaccinations and my booster shots, so so I'm all set that way. But I have not visited a doctor. I have not established a relationship with a doctor. I'm going to do that today in Florida. So a couple of questions you might have is like, why Florida, and how can you go that long without needing any medical care? And so I want to be totally upfront with you and tell you that I appreciate this opportunity in my life to be able to be out on the road and to be able to be healthy, because there have been times in my life where I couldn't be doing this. I would have had to have been very close to medical help. In my early 30s, I was diagnosed with Crohn's disease. I don't think that's what it was, but it led to 10 years of really chronic pain. I had some surgery, pain dissipated, had back surgery. I've had some neurological stuff with headaches and extreme fatigue. And so I haven't always been the healthiest. And it's like, you know what? I am so thankful that I have been able to get on the road and not have any major physical problems. And I have gotten healthier. I'm probably healthier now than I was 10, 15 years ago. Well, when I hit 50, I was doing karate and I was doing pretty good, but I'm healthier now than I have been in such a long time. So I don't take it for granted. I know a lot of you want to be out here and you're physically not able to do it at this moment. You get that break, you gotta jump out here and live your life while you can. So I do several things to try to be healthier. One of these is intermittent fasting. Another is I gave up alcohol. I'm approaching my 1-year alcohol-free anniversary. I walk a ton. I'll try to kayak. I'll do exercise. I feel good, like if I get about 8 miles a day, and that's a pretty good day for me. And I just feel so much better. But I still need to, I haven't established a relationship with a doctor since I have been on the road. Now, when I first researched health insurance, I was surprised at my age and given my history that I qualify for private health insurance. So I opted for private health insurance last year because I'm like, I travel nationwide and I need to be able to use it wherever I am. And it's like, you know what? Nobody recognized that company, that policy. In fact, I remember doing a Google search because I landed at South Padre Island. I thought, I'll get a mammogram. I haven't had a mammogram. Yeah, I know. Don't holler at me. I haven't had a mammogram in 2 years plus, probably. So I'll get a mammogram. And I went to the website and I put in, 100 miles of, the big city where I was closest to. Where can I find a service provider who takes this insurance to provide a mammogram? You know how many providers came up? Zippo, not a thing. And it's like, you know what? I've got this insurance that I can't use. I've been paying, I'm 58, so I'm at that place where the rates are really high, and I'm a long way from qualifying for Medicare, so I have got to figure out what to do about health insurance. This last year, somebody tipped me off to Florida. That is where I am domiciled, in Florida, and I did have a Florida health insurance plan initially, and then moved on to this other insurance. Now I'm back to the healthcare.gov, the Florida plan, and somebody clued me in. Now, as an entrepreneur, my income can fluctuate. Maybe it's going to be a great year, maybe it's going to be a second year, I don't know. But I have to manipulate sort of the income fields in healthcare.gov, because if I put in too little, like $15,000, then I don't qualify for health insurance. But if I put in like a minimum wage amount, I think it was 17,000 plus, then I qualify. So I'm like, okay, and if I put in a higher income, I'll get a little, less of a subsidy. My premiums are going to go up. So I had to like get a good sense of how much income I have anticipated this year. If I make more, I'll have to pay some money back in. If I make less, I'm dead in the water. But anyway, I realized that I could qualify for healthcare.gov, and I chose Florida partly because, you get like Texas, Florida, and I think South Dakota. Those are like the big three because the no state income taxes. So Florida has a Blue Cross Blue Shield policy. The other two states did not. So I know Blue Cross Blue Shield has a nationwide network. If I need some help somewhere other than Florida, I can probably get it. But I knew I'd planned my route. This is another thing. I am a planner, so I had planned my route to stay in a Florida state park. So you got to reserve these things 11 months in advance. So I knew I was going to be in Florida, where I was going to be in Florida, and looked around at who takes, it's blue, it's Florida Blue. It's very common, popular. Most places in Florida take it. So I checked to see what the physician ratings were in the areas where I am going to be headed. I made a call probably in January and found someone who's accepting new patients, and she told me, well, we're accepting new patients, but we don't have an appointment until April. I said, perfect, I'll be there in April, book me. So I had to really plan ahead to get an appointment. And yes, one of the things I will request is a mammogram. But I don't take any medications. My regimen is probiotics and vitamin B12 and fiber capsules and green healthy drinks. So I'm very, very fortunate. I recognize that every day. So, if you're out there, first of all, take care of your health, because something goes haywire, you're grounded, right? I don't want to be grounded. Also, I did want to mention, I did have somebody come visit me at one of my parks, the last place, and he had tested negative that morning but wasn't feeling the best. The next day when he got back, he tested positive. So one of the things with Florida Blue is I get to have four free test kits, 4 test kits a month to test for COVID. So I went ahead and got those 4 kits and tested negative, so that's cool. But there are a lot of advantages to trying to take care of most of my things here. The other thing I looked at is if I needed to get back someplace, this is not too far from the ocean, from St. Augustine, and I'm sure there are lots and lots of RV parks. So if I needed to get back to this area for some reason, for some medical care, I could do that. So, when you're out there thinking about all the things that you need, you've got to really plan ahead, and that is where I do use RV Trip Wizard. That is where that planning ahead has really helped me figure out, try to get a relationship, try to get some medical work done. So, be careful, be safe out there. Things you can't control, I understand, but get a relationship with a doctor. The other thing that I do have is Teledoc. So this insurance automatically, I've got an app on my phone for Teledoc. And so if something goes on, I have access to a nurse or whomever is at the end of that line 24/7. So if it's minor, hopefully I can get a prescription or get something taken care of there. So It's, you know, health insurance is not cheap. It's something you've got to budget for. So it's, but you need it. You need it. Okay. So wish me luck. Off to the doctor. I'm pretty sure I'll get a golden star. I've done some good things this year, and feeling good, and very, very thankful to have this life. It's awesome. All right, you guys, you take care and get your tests done, get all that stuff done. Make sure you're able to access your medical stuff on the road. All right, take care. See you later.